So what do you do?
So I'm an internist. I'm a doctor trained at Johns Hopkins, but I actually work with a lot of employers about their employee benefit health plans.
If an employer is wanting to figure out how to reduce the cost of health insurance in their business, what's one tip that you'd give them to consider?
To think about their high cost claimants every single day. Because 80% of their healthcare costs are driven by 20% of their claimants. 50% of their healthcare costs are driven only by 5% of their claimants. So you got to think about those top 5%ers if you want to do anything about your healthcare costs.
For an employer that thinks that there's nothing they can do about those high cost claimants, what advice would you give them about that?
Oh, there's always something that you can do about your high cost claimants. Sometimes you got to catch them early with primary care. Sometimes you got to steer them to the right specialist. Sometimes you have to do a direct contract with a facility for something like an orthopedic surgery. But there is always something that can be done about high cost claimants.
Okay. What's an emerging trend that you think employers need to pay attention to?
Oh, they need to pay attention to their healthcare costs, period. They need to stop being complacent and actually start caring about it because their employees are paying so much money and it's hurting them and they're hurting their families and they're not able to buy a house. They're not able to send their kids to college. They're not able to save for their retirement because they're spending so much on family premiums for their employer-sponsored health plans and they're paying so much for their out-of-pocket healthcare costs. So the employees themselves are hurting and the employers can do something about it.
So for that employer that's watching this right now that wants to figure out how to lower their healthcare costs, but they don't know how, what's the first step you think they should take?
They need to ask their broker what their 3 highest cost claimants are. Not their names, but like, what disease is it? What's the story with those 3? And that broker consultant should be able to answer that question off the top of their head. And if they can't, then they're not thinking about their client's problems as much as they should.
So you're somebody you've been in a lot of rooms where people are making healthcare decisions. You're going through the renewal process. You've been in with the HR manager and the CFO, business owners in some cases. What's a mistake that you see employers making when they're going through the renewal process with their broker?
Staying fully insured when they should be self-funded.
And what size clients or what size business would you say kind of on the low end would be eligible for something?
You can easily be 75 employees and be self-funded. I think if you want to go level funded, that's fine. But the point is that you need to understand your claims detail, and you can only truly understand your claims detail if you're self-funded. And frankly, there's so many options for the reinsurance and the stop loss that frankly, that shouldn't scare you away.